It's the dawn of a new decade. You can be you again with Shatkin Mini Dental Implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how Shatkin Mini Dental Implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hi, I'm Dr. Todd Shatkin, and welcome to our beautiful new Aesthetic Associates Center.
It is Innovations in Health, and I am John Discuillo, your host, and I am welcoming back to the show Dr. Todd Shatkin from the Aesthetic Associates Center. Dr. Todd, welcome back.
It's always a pleasure to be here, John. Thank you very much.
You are welcome. Dr. Shatkin, the mini dental implant, your procedure has changed tens of thousands of lives. People can be them again. You can be you again. Mini dental implant is 5 times less. It's less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. We've heard from some of the people that have experienced this. Let's find out why. And this first model is probably the best example of a conventional implant versus a mini implant and the difference that it makes.
Sure, John. Well, you know, I've been talking about mini implants now for a long time here in Western New York, and I started doing these back in 1999, so we're talking about 20 years that we've been placing mini implants. And prior to that, I did the conventional implants, which is a much more involved procedure. And with the mini implant, the reason it's so simple is we only make a very small pilot hole in the gum and then into the bone without cutting the gum open, without doing any major surgery. You don't have to remove bone or do major bone grafting procedures that can take up to a year to complete. This model shows it really well because if you look at this model, you'll see 2 holes. This hole is the size of a hole you need to place in the bone for a conventional diameter implant. And this hole is the size of the hole that you place for a mini implant. And the procedure is so wonderful because there's almost no discomfort afterwards. They can come in, they can have their implant placed, and they can leave with a tooth in the same visit.
That's important to note. These are in-office procedures at your facility, and we should mention the Aesthetic Associates Center is where Dr. Todd is at. They are the leader in cosmetic and implant dentistry. They're at 2500 Kensington Avenue in Amherst. The phone number is 716-839-1700. And you have a patent on the mini dental implant as well.
Yeah, actually, John, I have 3 patents at this point in time, but in 2003, I applied for and received my first patent for the single tooth and multiple tooth replacement in one visit. And that's what we were just talking about, where a patient could come in, they could have the implant placed and a permanent crown in just one visit, or multiple crowns in just one visit. And that's a tremendous advantage over the other system that can take months to years to complete. In the past, people used all kinds of glue and denture creams and denture paste to hold their dentures in. Now we use these little mini implants, and we usually put 4 to 6 of them in, and the denture then snaps right in, and it stays very secure. This procedure came out in 1999, and this is what they were originally designed for. And it's done in one visit, usually in less than an hour. What I came up with was the idea of using these same implants for other purposes, such as single teeth replacement, multiple teeth replacement, and even a full arch of teeth replacement, which we'll talk about a little bit.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't smile, I couldn't enjoy the foods that I liked as much as I wanted to, and I needed to have something done.
You can't eat with them, you can't eat without them.
I didn't want to smile.
Whereas the mini implants, I could do anything within hours of having the procedure.
The best part about it is I don't feel anything about it. I don't have to think about it. I don't have to consider it at all.
The mini implants are the only way to go.
I just want to say thank you.
Now, I don't know about you, but everybody in Buffalo, we love our food. We love our beef on weck, we love our chicken wings. It's all there, but with the upper mini dental implant, that sense of taste is now going to come back again.
It's returned again. So after doing the mini implants for the lower denture for about a year and a half, I started using these same mini implants to stabilize the upper denture. And what we did is we started cutting off the roof of the mouth on the denture, the plastic, so that instead of having a full coverage over the palate, they now have this horseshoe design where you can taste the hot and cold foods on the roof of the mouth. And they'll also be able to eat corn on the cob, which they couldn't eat with their old dentures because the dentures would move.
You mentioned earlier how your technique now can afford someone an incredible look as if they have a brand new set of teeth. Show us why.
Right, so those patients who just want to eliminate the dentures completely, and there's a lot of them out there. Some people just want to get rid of the idea of having to remove their teeth completely. And we can convert you from a removable denture to a permanent set of teeth. We have two options for you to do that. One is what we call our Fix on 12 procedure, where we put 10 to 12 implants in and we cement the teeth in like your own teeth again.
That's almost as if you're giving somebody their third set of teeth.
Yeah, you know, God created us with our baby set, and then he gave us our second set of teeth. But if we don't take care of those teeth, we may not have them very long. So then we have to replace them with a third set of teeth. And that's what mini implants can do. We can put these 10 to 12 implants in and then cement the permanent teeth right on top of them so that they're very secure. They feel like having your own teeth again. You can eat and enjoy any foods you really want to enjoy and not worry about having to take your teeth out anymore.
Let's talk about the other example that you have in front of you.
This is a procedure I developed which is called the Fix on 6 procedure, where we do a similar type of restoration to that Fixed on 12, but this one is detachable. What I mean by that, it's detachable in the dental office. A patient doesn't take this out, but the dentist can take it out when they come in for their cleanings and checkups. So this one snaps on also. It's very, very tight. It's still made of the same porcelain material. It's very strong and durable. Once it's placed in, it stays in all the time. Otherwise, it's very, very similar to the cemented option. But this is an option for patients and dentists who want to have something that's retrievable.
I had the Fixed on 6 done. It was awesome. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It literally changed my life. Now I come to Dr. Shatkin all the time.
Tell us why the Shatkin Mini Dental Implant is so affordable and it is so different than other mini dental implants.
The Shatkin First mini implant that we developed and we sell around the country to dentists and around the world actually is a fantastic procedure because the mini implant is so minimally invasive that it's coated with a product called Ocean. What it means is the implant integrates with the bone very rapidly. In a matter of 2 to 3 weeks, you get full healing of the bone around the implant, and that's a very unique product that we have.
When we talk about the mini dental implant, and we've talked about dentures and full sets of teeth, sometimes people may look at this and say, well, that's for someone who maybe is a little bit older or who has some significant dental issues. But if you have some teeth that are on the back, and I know in my own mind, if something's in the back of your mouth, it's out of sight, it's out of mind. But those teeth are very important for the chewing process.
They sure are.
And the mini dental implant can help, and a single tooth.
Yeah, we had a patient who played football with my son in college, and he got his front tooth knocked out, and we replaced that tooth with a mini implant right in the front. So here's an example of the mini implant replacing a front tooth, a single front tooth where we put the implant in and then we cement the crown right on top of it. And we do this quite a bit. This is part of my patented procedure, John, that I developed back in 2003 and that we teach our dentists to do, where you can place the implant and a permanent crown in one visit using the Shatkin First implant along with our surgical guide and our stent. We also do that for multiple teeth. So here's an example of 3 teeth missing. We typically put in 2 mini implants for a molar, so the molar would have 2 and the other teeth would have 1, and then that bridge gets cemented on top of it just like that, and it's a permanent solution. In fact, I believe so strongly in the mini implants, I had a tooth that I had to have taken out. It's a long story, but just about a year and a half ago, I had to have that tooth pulled, and I had the mini implants put in a permanent crown, and it's perfect. I eat everything I want. I don't even know what's there. So when I had the choice of what kind of implant I would put in my own mouth, I chose the mini implants.
Of course.
So I will treat you the same way I'll treat my own family with mini implants.
And we'll hear from some of these people now that have had a single and a side tooth option.
I couldn't eat even on my right side.
There were so many things I couldn't eat because I couldn't bite on the front.
It was sore, it hurt, I couldn't chew.
My self-confidence was very low.
I was constantly having my hand over my mouth.
I would cover my mouth.
I had went to other places and it was kind of expensive for me. Dr. Shatkin made it financially able for me to get them done.
I have mini dental implants with a bridge.
I had mini implants.
There was no discomfort during the procedure.
I didn't feel any pain.
I just feel so much more self-confident.
But this just worked out great.
Get your smile back and be able to eat and feel yourself again is so rewarding.
It was one of the best things ever.
I'd recommend it to anyone.
It just changed my life. You know, it made me feel more confident.
It just changes your life.
It makes a big difference. Yeah, it does.
And Dr. Todd, we should mention that all of this is happening at the Aesthetic Associates Center on your campus. The teeth that you're talking about, when we talk about a single tooth or the bridge, these are made right here in Western New York with hometown people.
That's right. It's very exciting, actually, John. We have about 50 employees who work with me chairside, assisting me, running my office, and also running the dental lab and the implant company across the street at Shatkin First. When a patient comes in, we take impressions, we take x-rays. Everything we do is digitized into a three-dimensional computer model. So when we make the crowns, it comes out of a milled block of porcelain. It's all designed beforehand, and then it's sent to a printer, essentially, that mills this from a block of porcelain into a beautiful tooth. And we design the teeth and the restoration, customizing the color, the shape, the contours of the teeth, so that it works in the patient's mouth.
Well, you can't do this alone, and I know one of the dentists that have been with you a long time is Dr. John Lucchese, and you've kind of mentored him along a little bit. Tell us about Dr. John.
Dr. Lucchese's a wonderful dentist. He's been in practice in Western New York for over 35 years. He joined our practice about 6 years ago. He's been a tremendous addition to our practice. He's an excellent clinician, and he performs all phases of general dentistry, cosmetic dentistry, and implant dentistry.
All right, well, let's find out why working in Western New York is so important to Dr. Lucchese.
Born and raised in Buffalo, Kenmore, New York. I've known Todd for over 25 years. I've been practicing for 35 years in dentistry. My father practiced for 50 years, so I know the Shatkin family for a long time. And he said, why don't you join our team, and you could help me in the office, and you could also help me lecture. And I said, you know what, Todd, that's a great idea. And so I joined July 1st, 2014. My father who's practiced for 50 years, brought my mom in, and we've been nursing this one tooth in the front. And I said, you know, we're gonna have to take it out. 6 to 9 months later, we'll be able to put a tooth on there, because that was my experience with the implantology. My father says, well, why don't you just do a mini implant? I said, you know, you're right. And we were able to put a mini implant in the palatal bone, and I was able to retrofit the crown that I just made 3 or 4 years ago onto the implant, and it's been there for 5 years now, and 26 minutes is pretty neat stuff happening. So it's been very rewarding. It's been very helpful to other patients that we've been working on, and you know, it's pretty neat seeing patients after 30, 40, 50 years that your father worked on, you worked on, and they still have teeth in the mouth and still smiling and are very healthy. The community itself is unbelievable, and we're all here helping each other out, as well as helping the patients and people here in Buffalo and trying to make things better and better. And the people are always very gracious, and I've seen that and I lived it. It's nice. Family.
Well, it's great to meet Dr. Lucchese, and you've brought some other dentists over now. I know that Dr. Bernie Eisen is a part of your team. Your team is growing.
Yes, John, we're thrilled to have Dr. Bernard Eisen, who recently joined our practice a few months ago. He's been in practice in Main Street office in Williamsville for decades, and I've known Dr. Eisen for over 30 years, and we're thrilled to have him and his team join our practice. And we welcome all of his patients from the Western New York area to come to the Aesthetic Associates Center to see Dr. Bernie Eisen and his team.
Well, I went to the University of Buffalo Dental School, graduated in 1980. Dentistry has changed 1,000% from those days. As Todd reminded me, I was helping him when he was a pre-doctoral student at the Buffalo General. I'm obviously always impressed every time I drive by the area and see the expansion of what he offers, and he offers a very unique product to the dental community, and it's a great product and a service to patients that need that kind of work. That's probably the most exciting part. Every day I see something else going on at Shatkin Dental Health or across the hall that amazes me, that we're just doing this or just every day there's something different going on.
So we have dentists, Dr. Shatkin, who are from Western New York, but now Dr. David Powers is someone who's come in from California because he wants to be a part of the cutting edge technology that's happening right here.
Well, you know, we're so happy to have Dave Powers join our practice about a year ago. I've known Dave for about 15 years. He's just a wonderful friend, but a tremendous dentist, and he does so much for our practice. We're just thrilled to have him here. And you know what? I love Buffalo, and I love Western New York, and I love sharing it with people from all over the country when they come to take our courses here in Buffalo. And he was excited about it, and I'm thrilled to have him here.
Basically, I went to one of Dr. Shatkin's courses in Las Vegas about 15 years ago, and him and I kind of hit it off there. I was very intrigued by what he was doing with the mini dental implants. Took it back to my practice. I built my practice for the next 15 years and saw that there was an increasing need in Western New York for the mini dental implants, and Dr. Todd asked me to come here, and I agreed, and here I am. I was so intrigued by this change in dentistry, and I just saw what it was going to do, and basically the first patient I ever did it on was my mom. And when I sat her down and I did the treatment, I pushed the chair back and I said, this is the easiest thing I've ever done in dentistry, both for me and the patient. And I just said, I'm going down the road of mini dental implants. At this point, I placed over 15,000 of these mini dental implants, and I continue to help Dr. Shatkin expand the aesthetic associates with the mini dental implant dentistry. I have them in my mouth, my family has them in their mouths. I wouldn't think about doing any other procedure for my patients. The people of Western New York are just wonderful people. I haven't had a bad meal, I haven't met a bad person, and people will say that, you know, going to Buffalo, you have to deal with the weather. Well, it hasn't been an issue for me, I've embraced it.
Dr. Todd, it was great to meet Dr. Powers, and he and his family are making Western New York their home. And we should mention, everybody, that Dr. Shatkin and the Aesthetic Associates Center is the recipient of a 5-star Diamond Award, and that's not only for dental expertise, but for customer service. And let's find out why.
Dr. Shatkin has created a great culture in his office.
It's always a great experience.
I was blown away by the service.
The staff is great.
His staff was very friendly.
It feels comfortable.
I've seen Dr. Todd, I've seen Dr. John, they've both been fabulous.
He was very informative.
You know, I've recommended them a lot to a lot of my closest friends and family members.
I would recommend them to anybody.
10 out of 10, all the way.
Your Aesthetic Associates Center is growing. You know, where you are, 2500 Kensington Avenue, many people have gone there, and they've experienced life-changing procedures, not only with you, but with your dad and your brother. And the Aesthetic Associates Center has a long history, and it's growing. Tell us.
Yeah, John, it's been just a privilege and an honor for me to work side by side with my dad for the first 20 years of our practice. You know, he passed away in 2010. And then working with my brother for over 30 years now, both of them being board certified plastic surgeons. And the fact that my father was also a dentist before he went to medical school to become a plastic surgeon. So it's just been just a wonderful ride, and I'm just thrilled to be here practicing and loving what I do every day. I tell the dentists that train with me that I wake up every morning about 6:30 in the morning, and I cannot wait to get to work because I love doing what I do. And not everybody can say that about their respective professions.
Well, you have a great passion for it. You work early in the morning till late at night. And these dentists that are coming in from across the country are now coming into your building. And I was there for the grand opening when you expanded. And you have a whole setup now that people can come in and learn so much. Tell us about how the building has expanded.
Yeah, well, this past year we opened our new building. It's an additional 15,000 square feet over our previous buildings that we have. So we have about 45,000 square feet of office space that we're fully utilizing in-house by all of us. And we're doing a lot of stuff there. It's really exciting. We can train 140 doctors at a time now in our main conference room. We can also train an additional 100 doctors in our subsidiary conference rooms that we have. My brother uses that space to teach Botox and fillers to medical professionals around the country. So it's really very exciting.
I think it's wonderful. Learned a lot. I do every time I come.
I love doing minis, and every time I come to the course, there's new techniques, new materials, new procedures, and I always come back invigorated and excited about what to expect in the future.
It's like a big family. They're always here to help you, and you can't do anything better than Shatkin first.
The camaraderie here is second to none.
Just see the new facility. My goodness, this is an amazing amazing facility that he's built.
Every time I come here, I learn something more.
There's a lot of good information, and I learn something every time I come as well.
The hospitality is fantastic.
Wide variety of topics were covered, a lot of good cases.
I learn an immense amount, and I take it to my practice every day, and it helps me.
I just want to say that it's such a pleasure to have Ed come all the way from UK to so many of our courses. It's an honor and a privilege to have him here. He's a great dentist, and we love working with you over there. And thank you for being a loyal customer of Shatkin First.
Well, thank you very much. It's been a great course as normal, and I've learned a whole ton of new things. And every time I come over, there's something new.
It's been great. It's been a great experience.
Everybody here, top on down, is a first-class operation. Always.
Dr. Todd, that practice started with your dad, and now with you and another generation. This is your son, Jared. Jared, welcome to the show.
Glad to be here, John.
And with another generation of dentists, Jared, where are you going to school, and tell us about your experience right now.
Right now I'm at Tufts University School of Dental Medicine in Boston, Massachusetts, and I'm just learning kind of the nitty-gritty of dentistry before I come back to Shatkin First and become the superstar my dad is.
Well, obviously with the connection with your dad, what do you think of your dad's accomplishments?
I'm proud of him. I don't tell him that much, but I am proud of him, and it's pretty amazing what we have here in Buffalo, of all places.
So Dr. Todd, I mean, without saying, this is a moment, because now you're continuing with the generation. How do you feel about it?
Well, I'm incredibly proud of my son, Jared, for what he's accomplished in his own right. And he's going to be more of a superstar than anybody else was. And I know my dad is looking, his grandfather's looking down, beaming with pride as well.
All right, Dr. Jared Shatkin, that's how we'll address you the next time you're here on the show.
That's right. Thank you very much.
You're welcome.
Appreciate
Good luck
it.
to you.
Thank you.
And we should mention, Dr. Todd, in addition to your son now going to dental school, recent graduates are coming to Western New York to participate in this practice with you.
Well, we're really excited, John, that the younger dentists recognize the things that we have to offer at the Aesthetic Associate Center and want to join our practice. One such individual is Dr. Sirat Maan, who joined us about 2 years ago. We think the world of her. She's just a wonderful human being. She's a fantastic dentist. She's got a great bedside manner, and you're going to love her if you come to see our office and meet her. She's just tremendous.
I came to United States in 2013. I went to NYU, and I was fortunate enough to find Dr. Shatkin and come work with him. I love Buffalo. It's very different from New York City, slower pace, but I love it. People are so warm and friendly. I get to enjoy nature. There's no rush hour. I love Buffalo. The whole team here is very friendly and very pleasant people to work with. Dr. Shatkin, he's an amazing person, amazing dentist, and amazing mentor. It's a beautiful facility. We have state-of-the-art technology. And this side we have Shatkin Dental Health Center, which is our new residency program. We're gonna train young recent graduate dentists for 1 year before they can go out and practice. I am one of the instructors at Shatkin Dental Health, and I'm gonna help train young recent graduate dentists to place mini dental implants. Dentistry is like the perfect profession for me because through my learned and my creative skills, I can help improve the appearance of my patients and boost their confidence. And you want to have that smile so that you can be you again.
Dr. Todd, it was great to meet Dr. Maan and all your team. And you have a residency. Explain how this works.
A graduate dentist from any dental school in the country that wants to practice in New York State has to go through a 1-year residency program. And what that means is they have to spend a year being mentored by other dentists in either a hospital setting, a university setting, or in our case, a private practice setting. We're very fortunate and very honored actually to be the only residency program in Western New York in a private practice setting.
And this affords the patient less cost with some of the opportunities that they would have for their dental work.
That's right. It's kind of like a university pricing structure. So the students who are dentists, they're full-fledged dentists, they graduate from dental school, will be performing the dental work on the patients with the supervision of myself, Dr. Lucchese, Dr. Powers, Dr. Maan, and Dr. Eisen. And because they're still in training, we offer about a 30% lower fee structure to them over what they would pay in our regular practice. Our Shatkin Dental Health program accepts most dental insurances, and we also offer financing options to spread your payments out over time. Then I want to emphasize, it's kind of like having two offices in the same location. We have my own private practice, which I've been in 30 years, and then we have the Shatkin Dental Health practice, which is a new practice, which is the same quality dentistry, just at a lower cost for patients that are okay being treated by younger dentists, but the quality of the work will be phenomenal, and you'll get a little better price like you would at the university.
And your mind never stops, Dr. Todd, because now the Eye Smile Spa is out there for people who, like me, want to smile and look good.
Absolutely, John. We're pretty excited about Eye Smile Spas. It's our new Smile Spa right at the Aesthetic Associates Center in the new facility. And what it is, it's a new concept that I brought to Western New York where patients can get their teeth whitened and brightened. You know, we had Thurman Thomas and his wife in there recently and their daughter. We had a lot of the current Buffalo Bills and Buffalo Sabres players coming there. It's really spreading. It's very exciting. What we do is we whiten and brighten your teeth, and then we have a program where you can join the Eye Smile Club, where you can get unlimited whitening during the course of the year for $39 a month. It's a monthly subscription. So once you get the initial treatment done, you can come in for a whitening, and then you can join the Eye Smile Spa Club and come in as often as you want to have your teeth whitened during the course of the year. I want people to be able to have whiter teeth all year round. They can come in and get a touch-up whitening treatment done. And we also send you home with a whitening kit as well.
The first thing everyone notices is our smile.
I heard about their monthly unlimited plan and I had to get started. I couldn't be happier. My teeth look so white. They even gave me this take-home kit.
You deserve a smile makeover. Call us today at 43 Smile.
We checked out the website. You have so much to offer. The mini dental implant, the Shatkin Mini Dental Implant, because you have a patent, several patents on it.
Yes.
You're changing people's lives. You take care of it with a water pick and a visit to the dentist.
Yes, we recommend an electric toothbrush, a water pick, and coming to the dentist regularly to maintain their teeth.
And you have a patient named Ashley, I know, very special to you.
Yeah, Ashley's a wonderful gal. She's just a very lively young lady who had a bunch of missing teeth. And she came in and we ended up doing mini implants on half of her mouth with permanent bridge work, and it's really changed the way she feels and changed the way she looks at herself.
I was in a car accident. My front tooth cracked. I'm definitely embarrassed to smile. I got mini dental implants. It changed my life because it made me feel like me. Like I can smile and feel like Ashley. I just want to say thank you.
So you've changed her life and so many others.
I think we have, and we enjoy it. And like I said earlier, I love what I do. I can't wait to wake up in the morning and go to work because I love changing people's lives and helping them look their best. Because at any age, we want to look our best. Whether we're young, middle age, or older, it doesn't matter. You want to look your best, you want to feel your best, and of course, you want to enjoy what you're eating, enjoy the foods, and not worry about not being able to chew them or swallow them. If you feel good and you want to continue to feel good every day, you want to have a full complement of your teeth.
And you can do that at the Aesthetic Associates Center, the leaders in cosmetic and implant dentistry, with the Shatkin Mini Dental Implant at 2500 Kensington Avenue in Amherst, 716-839-1700. You make the call, you set up a free consultation. Dr. Todd and his team will talk to you. Dr. Todd, so much that we've covered here. You are an innovator in health here in Western New York. We are, as a community, blessed to have you and your team here.
Well, thank you so much, John, and it's a pleasure to be here, and I look forward to joining you again next time.
Thank you very much, and thanks for watching Innovations in Health.
Comfortable and quality dental care. Affordable prices, always fair. 839-1700 to call. 'Cause happiness starts with a smile.